within a healthcare environment is really integral to ensure quality of care as a whole. When we think of environmental cleaning and specifically healthcare facilities, we know that microbial contamination of surfaces can lead to the transmission of healthcare-acquired infections, as well as to contribute to the development of antimicrobial resistance. In order to really understand this more, these more robust systems for routine environmental cleaning are really essential to reduce the risk of healthcare-acquired infections that patients, visitors, staff, and really anyone within the healthcare environment face. And in order to really to focus on this more, we need to kind of zoom in and focus on the staff responsible for cleaning. So that either that's cleaning the floors, the surfaces, those individuals, cleaning staff need to be, identified for starters. They need to be trained, provided with the necessary materials to do their job effectively, whether that's PPE or just, the disinfectant materials, mops, and so on and so forth, to be able to effectively clean the environment and to really approach infection prevention and control within the healthcare facility. So when we talk about these individuals, we're really talking about cleaners within the healthcare facility. So who are cleaners within the healthcare facility environment? So they're often a neglected set of workers within the healthcare facility. They have limited respect for their role. Oftentimes they're not part of the healthcare facility hierarchy. They usually lack formal training, whether that's training on infection prevention and control, how to clean, cleaning procedures, waste care management, and they also most often lack effective personal protective equipment and other supplies to do their job regularly. And again, as members of kind of the lowest rung of the healthcare facility hierarchy, they're often not really included or lumped together with how we think of normal healthcare facility stakeholders. So oftentimes they don't really have a seat at that table. They don't have a voice to advocate for themselves within the healthcare facility system. So I'm including here just the JMP core indicators. We all know and love the main components here, but for environmental cleaning practices, the basic definition that the JMP includes are really these two indicators. So asking, are cleaning protocols available? And have staff responsible for cleaning received training? So while these are great indicators that have slowly started to measure global progress in this space, there's still so much more beyond this that we need to learn. But I will say, so here's some of the global data that's been showcased more recently. So since 2019, we have seen more data coverage on environmental cleaning globally, with 21 countries there having these indicators. And so we're seeing that service is rapidly growing over the course of a couple of years, but it still remains low when we're comparing it to the other components such as water, sanitation, and hygiene that have a lot more data available, a lot more data coverage to really understand what is being done within each of these countries.
So the first resource that we developed was our best practices guidance, which was published in 2019. So there are three main content chapters. Chapter 2 is about the best practices for cleaning programs. And then there are two more technical chapters that stem from there, one on cleaning supplies and equipment and one on procedural best practices in different types of patient care areas. But chapter 2, focusing on chapter 2, because it's really an overarching chapter that describes a multimodal approach for implementing environmental cleaning. So a multimodal approach is a term that we use frequently in IPC to describe putting multiple strategies and multiple systems in place to enable effective and sustainable IPC practices. So we've included 5 multimodal cleaning program elements in that chapter 2, which you can see along the top, ranging from organizational elements, so focusing on administration and leadership support, to staffing and training, infrastructure and supplies, policies, protocols, and monitoring and feedback. So the toolkit enables progressive implementation of these multimodal cleaning program elements by providing a structured process for assessing environmental cleaning programs against the defined best practices, providing an approach for prioritizing needed actions and activities to make improvements. And finally, it provides a suite of tools and resources to actually help facilities implement those improvements. The toolkit follows a 5-step cyclical process, which we know from WASH. It is what is used in WASH Fit, and it's also used in WHO's IPC implementation manual. So this 5-step cyclical process is based on continuous quality improvement. And what it does is that it provides an opportunity for progressive and incremental improvements to be made over time through repeated application of this sort of project cycle.
One of the major lessons was the fact that we needed IPC champions to successfully implement the toolkit. And so to deal with all the organizational complexities, bureaucracy, IPC champions were very key. In training the cleaners, we had to contextualize, the resources we had such that, we could, communicate what needed to be communicated. We used a lot of role plays and demonstrations while training. We also used local language. And then what we've done post-pilot is that we have, reduced the trainings into smaller sizes, and then we train them on the job. And so we train them on the words, groups of about 15 to 16 people, while we also assess, what they do on the job. The third point, or third lesson is that morale and motivation of cleaning staff should be a key consideration. And so what we did was that we issued certificates of competence, which for some of them was the first time they will get such certificates after they were trained. And I already spoke about the module we introduced. And finally, a collaborative team-based approach involving all cadre of staff was crucial towards sustainability. Prior to the pilot, what we had was, we had different people doing their own things, the nurses on their side and the cleaners and health assistants. But in bringing everyone together, it helped us to, at least improve the quality of environmental cleaning.
It's a package made up of 5 main documents, a sort of oval instruction, and this is a package to train cleaners in the front line. Cleaners, and typically it works through a cascade model of having a master trainer who then trains a person who supervises cleaners in facilities, and that person then trains the cleaners. Very much focused on being something very practical, including illustrated guidelines. One of the documents is illustrations of how to clean. WHO asked us, I think initially in 2019, if we would be happy to turn over Teach Clean as a basic resource that could be used and updated and made available as a WHO document. It was finally released. It builds on Teach Clean, it updates it. And the purpose of the package, it has the WHO package has these a focus on the trainers and then a set of resources. And they have a very practical way of presenting it so that people can really build on it and use it, contextualize it.
What really came through is the national partners collaborations and how much that made a huge difference in the contextualization piece. That was incredible. I think going forward, one of the issues that we encountered was how difficult it was to actually make sure that the routine daily cleaning was happening effectively with really limited resources. And I'm not just talking about infrastructure and equipment. I'm talking about human resources. Very few cleaners, very difficult, lots of difficulties in task shifting and so on. And I think this is something that the Cambodia government is now thinking about, because they're thinking about national rollout. And they're thinking, how can we turn this around? We've trained cleaners, they know what to do, they're committed. But how can they be enabled to routinely clean when we have so few of them?
Frankly, we are failing women cleaners and healthcare professionals if we don't ensure clean, safe birth and a good hygienic environment for delivery.